Thank you once again for spending a few minutes and joining us with FHN's Community Education video. This week, I'm very pleased that we were able to secure Margie Kochsmeier, our infection preventionist, to be able to spend a few minutes to let you know what's going on at the front lines, the seriousness of what we're up against, and give you a frontline view of what's happening throughout not only our organization, but our community as a whole. So thanks for your time and attention, and welcome, Margie.
Well, COVID and influenza have some similar signs and symptoms: fever, body ache, sore throat, headache, and just an overall feeling of tiredness. COVID spreads more easily than the flu does. It causes more serious illnesses than what we typically see with the flu. Patients that have COVID-19 have reported a loss of taste and smell. We typically don't see that with the flu. There's an annual vaccine for the flu, and we are working on and very close to a COVID-19 vaccine. A person can have both flu and COVID, and we've had patients with both. They are two different viruses. It's important, though, to remember to be vaccinated for diseases that are preventable. The viruses for the flu and COVID similarly are transmitted through respiratory droplets. And this is why we have to be very careful and continue our precautions, our mask wearing, our social distancing, and our hand hygiene. You can be asymptomatic, meaning not having any symptoms for both COVID and influenza. So that means that you could transmit it from one person to another without even knowing that you were ill. We know that when we're outside, the air is more diluted, so it's actually better for us to be outside if we're going to be doing some visiting with people. We can keep some humidity in the house. People think that because it gets cold out that the viruses are all killed off, and that's not true. They actually float on dry air. So maybe opening up the windows a little bit, getting some fresh air in, putting a little humidity into the rooms, and like we talk, even with influenza, keeping those high-touch surfaces wiped down that are touched by many hands, the refrigerator handles, the light switches, countertops, keep those wiped down so that germs aren't being transmitted from one person to another. Products that you typically bought a year ago for disinfection and cleaning may not be available to you now, so know that you can use soap and water and a towel to remove some of these germs in the home. If someone in the house has COVID and there is someone living in the home that is very susceptible, meaning they've got diabetes or they're over the age of 65, they may be a cancer patient, they may have chronic lung or heart disease, try to keep your distance from those people. You could wear a mask at home and try to stay separated from them, but know that we have seen very healthy people that have gotten sick with COVID-19 and they did not fall into the risk category. Outdoors is always going to be better, again, because that air is diluted. If you are indoors and you can't be outside, even opening a window just a little bit to let some of that fresh air in will be very helpful. And remember that those germs are not killed with cold air. They float on those surfaces because it's very dry, and they survive that way. It's going to take a vaccine for COVID-19 to stop this pandemic, and it's going to take about 60 to 80% of our population to take it for it to be effective. One of the manufacturers of one of the vaccines is saying that there's between 90 and 95% effectiveness with this. So we're going to want to take this vaccine so that we can get back to those lives that we were used to before. Well, as this pandemic continues, we are learning more about it. We do know that COVID is transmitted in respiratory droplets that can land on your face or on surfaces, and then we touch the surface and touch our face. This happens when people talk, cough, or sneeze. We've learned that there are masks that are more effective. So a mask that is a single layer is not going to be as protective as a mask that has several layers of material that will protect you. Make sure that when you're wearing your mask, you're not touching the front of them, because remember that those are contaminated. The CDC has some recommendations for the holidays. They're saying to limit your guests to 10 people, and know that if anybody is coming from out of town, that is going to be more of a risk. Think about who is attending your gathering. Is it somebody that has a chronic condition, or that if they got COVID, they could become seriously ill? Consider seating people every other spot at the table, or opening the window to let some of that fresh air in. The other issue is that a lot of Thanksgiving or Christmas dinners are served buffet style, and those are a lot of hands touching each one of those utensils. So you can consider having one person serve, but really everybody should be washing their hands before and after their dinner. And then if somebody is sick or has been tested for influenza or COVID, they should not be attending. We're at an all-time high right now for our COVID numbers. This is higher than we've saw numbers earlier in the year. As we start to prepare for holiday get-togethers, we could see this driving our numbers up even higher than where they are right now. COVID is a serious disease that needs to be taken seriously, and we are seeing people die that did not fit into the high-risk categories. Minimize the number of people that you are in contact with. Continue to keep those distances of 6 feet. Wear your mask, hand hygiene, and stay home if you're sick.
Well, it certainly is getting worse throughout the remainder of the state. In fact, at the time of this recording, the Governor Pritzker, released that COVID-19 was the third leading cause of death in 2020 throughout the state. It was only surpassed by heart disease and by cancer. That's a pretty shocking figure. As we're recording this video, I just received the latest numbers from the Illinois Department of Public Health, and just today alone, they reported over 14,000 more positive patients in the state, as well as 168 deaths. And the overall positivity rate is still hovering at 14%. Here in Northwest Illinois, we are certainly experiencing an uptick and an increase, which means that we need to double down on all of our safety precautions and to do whatever it is that we can to help slow the spread throughout Northwest Illinois. Many hospital systems are working together to ensure that we're able to have enough bed capacity for the influx of patients that we're seeing, as well as being able to keep our staff safe at the same time. So the rate is increasing exponentially, and it's something that we all have a very close watch over. This is extremely serious when we think about not only other public health emergencies, but even some of the most tragic wars that we've seen over the number of years since America's founding. It's been pretty significant. At the time of this recording, we have recorded over 250,000 deaths, so over 250,000 deaths in the United States related to COVID-19. To put that in perspective, only World War II had more casualties with 450,000. Beat that number was the Civil War, where estimates were close to 700,000, and of course that was a much lower population. And then the pandemic in 1918 through 1919 is estimated to have taken over 600,000 lives. But in comparison to those three events, COVID-19 is coming in fourth place, which is not a good place to be, and the numbers are continuing to grow. So it's the most significant thing that many of us have seen in our lifetime, not only from a pandemic or a virus standpoint, but as well as many other tragedies and wars that we've seen over the many years. For FHN Memorial and FHN overall, as we're one FHN and we work together, we've been asking our incredibly brave staff to look at doing things differently and working in different locations so that we can meet the patient need. Many of the nurses and staff members that have worked in our provider practices or offices are coming into the hospital to help the staff members working at the hospital, the nursing team, but not only them, anybody and anyone who needs a helping hand. And so they've been an all-in approach to try and support one another as we keep up with the increasing numbers throughout this pandemic. We are continuing our preparation. We've brought in extra beds from outside facilities, so from some different area hospitals as well as state resources, in order to be able to flex up for the potential need that will follow after the holidays. So our staff remain committed to keeping our community safe, and at the same time we're committed to trying keeping our staff safe. So we're asking all of you to do what you can to help us as we prepare from staffing, supplies, and equipment for this ever-increasing uptick in activity that we've seen. I shudder to think that we would be overwhelmed, and we're a long way from being overwhelmed. Currently, we're still operating with 100 licensed beds, and we can surge up to 170 beds for holding patients. One of the challenges is if we get to that number is just having enough staff to be able to care for those individuals. And it's only with our staff, who are our most precious resource, that we're able to ensure the safety of our patients and deliver the truly exceptional care that all of our families deserve. If we were to see large numbers that were pushing us into that upper end of the surge capacity, we would be looking for volunteers from across the area and from across the state to try and help. One of the challenges with medical professionals is they're already being tasked in many other areas of the state, and there's a healthcare worker shortage that we're seeing not only here locally but across the nation. So there's not a lot of hands available to help, and so we would be looking at engaging community members, perhaps doing some real or just-in-time training so that they could assist the caregivers that we do have in trying to care for our families as well and as safely as possible. It's likely that there's a combination of things that may be causing this surge to happen. It could be a change in the weather, being a little bit cooler, people spending more times together indoors. It could be that the virus has been spread around amongst a critical number of people, so its communicability is increasing. It could be the fact that people are really fatigued of taking the precautions that need to be taken to control it, and that's understandable. But there are a number of factors. As our immune systems become weaker, it's a lot easier for the virus to take hold. And we know as we enter into the fall and winter season, and that's where we see a lot of cold and flu activity to begin with. So having cold, flu, or just seasonal type of respiratory conditions only make us all susceptible for an increased spread. So those may be some contributing factors of why we're seeing some of that uptick. But really it's all about numbers and being exposed to a critical mass and not following safe guidelines that have helped certainly to lead to the uptick, but not solely the only factor. I'm not sure why that is. A lot of discussion has been about pandemic fatigue and that we're really uncomfortable with all of the inconveniences that we're facing, though they're relatively minor when we put in perspective how ill people are becoming and ultimately could even lead to some deaths. There's been a lot of analysis on the numbers. I think the media has shared things that have become more sensationalized or less sensationalized. And so it's hard for people to gauge what's really true or what's really happening. And until you have something happen close to home, such as a family member or somebody that you know becoming ill, it's a lot harder to grasp the seriousness of what's happening. I encourage any of the viewers to go onto our website, www.fhn.org, and there is a radio interview that was done by Dr. Farhan Khan, where he shares his own personal experience with COVID-19, which is very sobering. He's a very healthy individual, and certainly it was something that truly struck home for him once he was affected by it. And I know for our FHN family, it was a very serious warning to all of us to try and keep safe. So even though we are all becoming fatigued, it's more important than ever we do what we can to help each other and try and stay safe as we continue to battle this ongoing pandemic. Some of the things that we can all do that are simple is focus on being healthy. And so that means making sure that you have a strong immune system by eating well, by engaging in mindful movement, by thinking about getting good rejuvenation or rest. At the same time, following those 3 W's of washing your hands, watching your distance, wearing a mask. And I would also encourage for a lot of social interaction. And when I talk about social interaction, that doesn't necessarily mean getting together face-to-face in person, but again, making those phone calls, interacting digitally, or just sharing a note. We can go back to the old style of actually writing somebody a letter. It could be very meaningful for somebody to be able to open that mailbox and get a card or a word of encouragement. But doing all of the things that we can to foster social connections is incredibly important, especially this time of year, as well as making sure that we don't turn to unsafe or unproductive type of habits, that we are working on making sure we're focused on nourishment, not just eating foods that are not good for us or in excess or potentially creating greater health consequences. And of course, making sure that we follow your physician's or your provider's guidance on taking medications, making your follow-up appointments, and not only taking care of yourself, but focusing on taking care of others and staying well. I believe it will be possible to slow the rate and the level of severity, but that's going to take a very focused and an all-in approach from our entire community. I don't believe it's going to be possible to stop the spread overall, but the importance of slowing the spread allows for all of the healthcare providers to be able to treat people at a rate and a pace that we can manage without becoming overwhelmed. So as we see the cases that are increasing and we see those numbers that are continuing to grow, if we can do that at a slower rate, that allows us to treat people and hopefully get them home so that we have space and we have the staff skill and availability to treat those other people that are coming in. So while we won't necessarily be able to stop the spread, being able to control the rate at which it spreads is a lot more beneficial for us to be able to manage, as well as it's a lesser impact from the entire economy when we're not seeing huge surges, and that we're able to do things at a much more manageable rate. If you're suspicious of having COVID-19, and it could be a number of things because the symptoms for COVID-19 are so similar to many other illnesses, is I would encourage you to go to our website, www.fhn.org, click on our symptom tracker. That will give you some good beginning guidance. I don't think there will ever be any type of screening tool that can replace the wisdom of a good provider or a good physician. So call your physician or provider office if you're in doubt, and they can help walk you through a conversation to determine if you really are at high risk for COVID-19. And if you were, they can refer you to our acute respiratory clinic that would be able to treat that condition, or at the very least be able to order some confirmatory tests for you as well. So don't put off contacting your provider's office. Don't put off looking online or asking those questions if you are starting to feel or show symptoms. And above all, if you are starting to show symptoms, be considerate of all the people around you and be extra cautious in trying to limit the spread. Over the next few weeks, I think I mentioned that a little bit on easy things that we can do to stay well, but I'll double down on the need for us to maintain our social connections. This is, again, a very frustrating situation for so many of us, but in order to move through this together, and we will get through this together, is to remain being future focused. Again, doubling down on the needs for acts of kindness and compassion, and looking at how we can make connections even though we can't gather together at groups, making sure that we don't lose sight of that we don't fall into the trap of social isolation, that we don't fall into the trap of engaging in unhealthy activities, and that we think about what are things that we want to do once we get through this, and to focus on what we're going to do in that tomorrow where we've conquered this COVID-19 pandemic. And above all, know that we are here at FHN to care for you in any way possible, and we appreciate all of your support in ensuring that we're able to do so.